So my name is Olga Kovalenko, and I'd like to talk about my practicum at Saskatoon Community Clinic. My practicum took place at the clinic, which is located in Treaty 6 territory and the homeland of the Métis. As uninvited visitor from Ukraine, who's white, cisgender, able-bodied, I'm lucky to be in this land and have opportunities for safety, personal growth, and education. Throughout my work and daily existence, I hope to be a responsible guest on this land. Saskatoon Community Clinic is a known organization in town due to its numerous community initiatives. The vision of the clinic states that they strive to see healthy people in healthy community, and their mission is to meet excellence and innovation in cooperative primary health care. The clinic has two branches in Saskatoon that serve different populations of the town, Downtown Clinic and West Side Clinic. West Side Clinic supports many patients who are marginalized due to their race, poverty, and substance use. West Side has wraparound services that vary from sessions with addiction counselors to outreach workers who help with the housing search. As I started my practicum at the clinic, I learned that they have partnered with a local harm reduction organization and are planning to start a program that will offer a safe supply of drugs to people who have addictions. Since I'm passionate about safe supply and I've studied in the past, I was asked to write a literary review about the topic. Additionally, during the practicum, I have conducted preliminary research on the topic of cooperative clinics in Canada, designed a survey to initiate engagement of West Side Clinic patients as members of the cooperative, and conducted the survey with more than 200 participants. As I mentioned before, the first practice scenario during my practicum at the community clinic was literary review on safe supply initiatives in Canada and globally. Lisa Kletny, the executive director of the clinic, was working on a safe supply program model to present to the clinic board of directors and asked me to research the benefits and potential risks of the intervention. The purpose of this research was to present evidence of the program's effectiveness and to address common anxieties and misconceptions that the board of directors might have regarding safe supply. I focused my research on safe supply programs in clinical settings because they are more translatable to the plans of the clinic than grassroots initiatives. Additionally, it was important for me to remember that Saskatchewan is a comparatively conservative province when it comes to harm reduction initiatives, and that safe supply program outside of clinical settings is unlikely to be supported by the provincial government. By integrating evidence-based literature in my review, I hope to change the attitudes towards safe supply among the board of directors and health practitioners that work at the clinic. In the Health 401 class, I have learned about many barriers to an evidence-based policy, such as insufficient evidence base, and the fact that policymakers come from a variety of backgrounds and might have limited knowledge in areas outside of their scope. Therefore, by integrating evidence-based literature in the review and by conducting knowledge translation, I aim to shift the mindsets of the board of directors of the clinic towards accepting new harm reduction approaches. Health inequities are avoidable discrepancies in health among different populations. In his book, Social Determinants of Health, that we all like so much, Davidson started that if we can do something about circumstances that will lead to someone suffering pain, disability, or death, and we do not, we are morally culpable. Many of West Side Clinic's patients come for support with their substance use. In this case, the health inequity is demonstrated by the lack of safe supply, which has the potential to drastically improve the quality of life of West Side Clinic's patients. The evidence of the effectiveness of hydromorphine and its better retention rates compared to methadone and Suboxone has been shown by clinical studies. Therefore, denying individuals this option equals causing intentional harm. During my practicum at the clinic, I gained an understanding that a safe supply program in clinical settings is the path of least resistance in the current political climate in Saskatchewan and might allow the provision of urgently needed medicine. However, considering the knowledge that I have gained by learning about social determinants of health, the clinical model creates many barriers to potential program participants by excessively controlling their lifestyles and personal choices. Therefore, in my future work, I aim to support and work with groups that create more inclusive safe supply programs and address common barriers to their access. I am very grateful for the opportunity to do my practicum at Saskatoon Community Clinic, and I would like to end my presentation by thanking my practicum supervisor, Lisa Klatny, for her support and guidance and for lending her books to me. And now I'll be happy to answer any questions you might have.